I want to know if my under-eye puffiness is genetic or can be cured. How can I know that? I hope it's not genetic, and if it is genetic, how can it be cured?
Thank you for your question. You're asking a question where you want to know if your under-eye bags are genetic or can they be cured. So I understand your question, and unfortunately, without a photo, I can only surmise that you basically are dealing with a family trait that you recognize as being genetic, and you want to know whether or not you can do something about it. Well, certainly I can give you some information. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. And as an oculofacial plastic and reconstructive surgeon, which means that I first trained in eye surgery before undergoing additional training in cosmetic surgery, I had a background in eye surgery and specialty cosmetic surgery of the eyes is an area of practice focus. So under-eye bags is one of the most common things I've been performing for over 20 years, in other words, to help people with under-eye bags. So let's start beginning with what are the under-eye bags that are most likely what you're seeing. Well, what it is it's something called lower eyelid fat prolapse. Lower eyelid fat prolapse means that fat pockets that are around the eyes pushes forward and creates these bulges, which look like bags under the eyes. Now, this type of characteristic is common, particularly in families, as a genetic trait. And so, within the same family, I've actually helped people in 3 generations. In a situation like yours, if you're asking, can it be cured? Well, certainly there are more than a few different solutions to help people with under-eye bags, and I'll describe a couple of them for you. If you have very minimal under-eye bags, in other words, there's a small amount of fat that's pushed forward, then it's possible to soften and camouflage the appearance of the under-eye bags non-surgically with an injectable filler such as Restylane. In addition, we sometimes find that, or often find, that in addition to the bags and the relative hollow adjacent to the bag, there's often discoloration in the skin and a very thin quality of skin. For this, we actually use something called platelet-rich plasma derived from your own blood to stimulate collagen and improve skin quality. But I think that what is more common is when people have more significant puffiness under their eyes. And when there's puffiness under the eyes, it's like a hernia. It pushes the fat is pushed forward, and the only procedure that really works is a surgical procedure. Now, in our practice, what we have developed is a process and a system so that even though it's a surgical procedure, we try to make the experience as minimally invasive as possible for the patient. What I would perform typically for, especially for people who have decent skin and who want to retain the shape of their eyes, I do a procedure called a transconjunctival blepharoplasty. Now what that means is that what I do is address the fat pockets that are responsible for this bulge of fat from behind the eyelid. And by addressing it from behind the eyelid, there's no outside scar. The shape of the eyes are retained and remain natural, and anyone who sees you would never know that you had under-eye surgery. Now, when I talked about I mentioned earlier about the way we do the procedure in our office, we have operating facilities within our practice. So it's as if basically you're coming in for an injectable filler, but we just bring you to a different room, and we do everything under local anesthesia with a little bit of what's called light sedation. This means that you're relaxed and you're completely not 100% aware of the process, but at the same time you're able to cooperate if necessary. It's called conscious sedation. what's really nice about this is that you can also avoid general anesthesia and you're able to leave, go home, and recover. And most people go back to work in less than a week. So if you're concerned about the potential fears related to surgery, that's one way to at least understand that this option does exist. Now, that being said, I would recommend that you meet with qualified, experienced doctors who perform a lot of under eye bag surgery, learn about your options. Again, in the absence of a photo, I can't make that much in terms of very specific recommendations, but understanding that your trait or the appearance of bags under your eyes is probably genetic, and it can be addressed so that you don't have to continue to have the under eye bags. In fact, I can tell you that for 20 years of practice, some of the happiest patients are people who no longer have under eye bags. To me, it's like a facelift. It just makes the whole face open up, and it makes such an impression when you don't have these bags under your eyes. People always think you're tired. People always think that you are lacking energy or you're older than your age. So learn about these options and find a doctor that you're comfortable with and move forward. So I hope that was helpful. I wish you the best of luck, and thank you for your question.